Tuberculosis is one of the deadliest diseases ravaging the world. Nigeria has been ranked the 4th country with the highest cases of the disease. That's our focus today on Sound Health. I'm Olasumbo Modupe. On innovation this week, medical experts reveal liquid biopsies find circulating tumor DNA. That's in a moment. Please stay with us. We'll be right back.
Tuberculosis is an acute or chronic bacterial infection found most commonly in the lungs. The infection is spread like a cold, mainly through airborne droplets breathed into the air by a person. Every year on 24th of March, the world marks World TB Day as one of the world's top health challenges, with 9 million new TB cases.
Not a single country today is free of TB or has ever eliminated TB. Increased commitment, increased investments has meant progress in the global response. Nearly 50 million lives have been saved since 2000, and deaths have decreased by 50% since 1990. But progress remains too slow for the size of this epidemic.
In the midst of the annual celebration, a fresh report released by the National Tuberculosis and Leprosy Control Program, a parastatal under the Federal Ministry of Health, has revealed that Nigeria has been ranked the 4th country with the highest cases of tuberculosis worldwide. The statistics also show that over 80% of tuberculosis cases in Nigeria were still undetected, while it claims over 1.5 million lives annually in the country.
It's still Sound Health, and we are discussing ending tuberculosis with Dr. Hussein Abdulrazak, the Tuberculosis Control Officer with the Lagos State Ministry of Health. Welcome to the program, Doctor.
Thank you.
So, Doctor, tuberculosis has been reported as one of the world's health burden. How deadly is tuberculosis?
Tuberculosis today has the enviable position of being the leading cause of death among infectious diseases. As a matter of fact, of all causes of death put together by WHO, tuberculosis is ranked number 5. So it's one of the leading causes of death in the world today. Well, tuberculosis is caused by a germ that we know very well, called Mycobacterium tuberculosis. We've known this germ since 1882, when Robert Koch announced to the world that he had found a germ that causes tuberculosis.
Okay.
So it's a germ that we know very well, and we have known for quite some time now.
Are there major symptoms of the disease?
Most importantly, and this is one we want everybody to know, cough is the key one. Tuberculosis affects all parts of the body, but most commonly it is in the lungs. It's transmitted through the air, so it's most often in the lungs, and the main symptom is cough. We try to separate this cough from other causes of cough by defining as prolonged persistent cough. This is the key one. Everybody knows this. Cough that has, everybody needs to know this. Cough that has gone on for 2 weeks or more. That is definitely something that we need to check. It might be tuberculosis. There are other symptoms, of course, but cough, that's the one we want everybody to know and everybody to be aware of. There are other things that can be involved: chest pain, fever, weight loss, sweating at night. When everybody is feeling cool, this person is sweating. Sometimes it gets complicated and the person could actually be coughing out blood. That usually is a late sign that this has really become severe disease. But tiredness, loss of weight, loss of appetite, all those other things come in. But the key one is cough. Cough, prolonged, persistent cough lasting for 2 weeks or more.
Through a tuberculin skin test can diagnose the disease?
No, it cannot.
Okay.
Definitely it cannot. What the tuberculin skin test does is to say that this person has been infected with the germ. That does not mean the person has disease. The analogy one would draw is with HIV. In those days, you have a HIV infection and then you have the disease stage when the person is sick. For us, like in Nigeria, for instance, we assume everybody is infected with the germ. Okay, but that does not mean we all have the disease. Most of us will live our life, all of us are infected. Most of us will live our life without having the disease. So the TST, the tuberculosis skin test, the mantle test, is only going to tell us that this person has been infected, which we are already assuming because of our high burden in Nigeria.
Okay.
Okay, so but to make a diagnosis of TB disease is a different thing.
Okay, what diagnosis can actually predict if someone is infected with the disease?
The key one is the gene expert test. It's the latest rapid genetic-based test for diagnosing tuberculosis, and that is the one that the national program is pushing now, the gene expert test. We also use, of course, the sputum, the age-old sputum microscopy using the zilnicin stain, what we call sputum for AFB. Okay. The key one now, the number one now, is the gene expert test.
Over time, quarantine and isolation for infectious diseases have been major preventive ways. Are they still effective?
Definitely not. Today we talk about integration. We want the TB patient to be managed like any other person that comes for healthcare service. Research has shown definitely that there is really no advantage in quarantining or isolating the TB patient. Right from the time they start treatment, in fact, right from the first dose, it's been scientifically proven. Right from the first dose, the ability to transmit the infection to others is reduced by as much as 90%.
Okay.
So what we need really is to identify those who have TB and start them on treatment. Once they are on treatment, there's really no cause for worry as such. And that's why 99.9% of our patients are managed at home. They come and take their drugs and they go back to their homes.
Is there a cure, and can the disease be prevented?
TB is eminently preventable, eminently curable. Even as, and that's one of the things that gives us concern, it's the leading cause of death among infectious diseases, a disease that is preventable and curable.
Okay.
So it means that we just need to get our act together. We can overcome this disease, and that's why we're talking now of ending tuberculosis. It is eminently endable if we put our act together.
How accessible are these centers? Because I understand there are tuberculosis and leprosy centers across the country. Are these centers accessible?
Well, like I said, we are talking now of integration. It's been one of the major focuses of our program in Lagos State to make access available. The ideal is that anywhere a person can access health service, he should also be able to access TB treatment services. Presently, we have over the years ensured that the services are available in all the LGAs. We have covered all the 57 LGLCDAs. Now we are working towards covering geographically at a world level. We started with 11 centers in 2003. Now we have over 450 centers where people can actually go. We still talk about centers because there's a program and people need to do things in accordance with that program. So there's a process of training them, getting them to key in and all that. That's why we are talking about centers. The ideal is that everybody who is offering health service should be able to also offer TB treatment service.
World Tuberculosis Day was created to raise public awareness. Are people really aware?
In fact, the number one challenge of TB control in our environment remains low awareness. And that's the importance of this World Tuberculosis Day, as a day set aside to create that awareness. Everybody has heard of tuberculosis in one way or the other. If you talk to people, they have heard about tuberculosis, but the right knowledge about tuberculosis is what is missing. And that's why the World TB Day is so important, because we want to also use it as an opportunity to increase people's awareness. Awareness creation should be an all year round thing, because really studies have shown awareness in society about 30%, which is really very low. So yes, we know people are not aware, and one of the focuses of our program, particularly for this year, is to ensure that we increase people's level of awareness. We need people to know, they have the right knowledge, not just know about TB. Everybody has heard of TB one form or the other, but that right knowledge, yes, people are not yet aware.
A fresh report released by the National Tuberculosis and Leprosy Program by the Federal Ministry of Health revealed that Nigeria is the fourth country with the highest cases of tuberculosis worldwide. The statistics also showed that over 80% of the cases were still undetected. How true is this statistics and how did we get here?
Well, yes, we have the fourth highest burden in the world. How did we get here? Tuberculosis is associated with poverty, associated with overcrowding. So where you have high density and you have low socioeconomic status, yes, we expect to see a lot of tuberculosis. So by population is one of the factors, and of course by that also you mean you're talking about population density. The highest burden countries are India and China, which are billionaires in terms of population. Okay, so that's definitely a factor. Poverty, overcrowding, definitely you have a lot of tuberculosis in such instances. Yes, the cases are missing. Our case detection is still very low, and it's what we're talking about, this low awareness thing. We are focusing on ensuring the service is available, but people still also need to know that yes, this is tuberculosis, this is how it is transmitted, this is what causes it, and this is where they can go when they need the service. So it's work in progress actually. We are aware of these statistics and we are working hard to ensure that we improve on them.
Could population be attributed to the high cases recorded?
That's what I said, density, population density. For instance, in Nigeria is fourth highest burdened country in the world, and in Nigeria, Lagos State happens to have the highest burden. It's simple. We have the highest population within the smallest landmass. So it's about the population density. It's like we are sharing the same air. We are closer together, sharing the same air. So it's actually easier to transmit tuberculosis where there is high density of population.
Stakeholders believe resilient health facilities will address the prevalence. Are our facilities fortified for this?
The tuberculosis does not need a lot of special facility, and that's why we can say that anywhere a person can go to receive for any form of healthcare, he can actually receive TB treatment services there. What is more, I use the word difficult, more specialized if you like, is the diagnostic services. The laboratories, if you are going to do A/B microscopy, for instance, using the analysis thing, you need definite infrastructure. But if it's about treatment, I can sit almost even in the open air and give a patient his or her drugs. Okay. So the facilities are there, and we are covering them as much as possible. Like I said, there's a process of engagement, a process of training the personnel so that they can do it right, the way it is expected to be done in accordance with national guidelines. So that's the process that has slowed us down. But like I said, we have been able to move from 11 to 450 plus now.
With the structure in place, how realistic is the goal ending TB by 2035? Well,
it is realistic. It is not impossible. Okay? But we know that we need to do a lot more. Tuberculosis is something that's curable, preventable. If we get all our acts together, yes, we need to do a lot more. Like, for instance, all these 450 plus facilities that we have where people can go to, a lot of them are underutilized. Okay. So if we are able to create that awareness and people start using this, the service is available there. Drugs are available free of charge. So treatment is free of charge. Even the diagnostics is available free of charge. If people will make use of them, being aware that cough for 2 weeks or more is likely to be tuberculosis, and they go to make use of these services, we can in a very short time cover up this gap in terms of diagnosis, in terms of case detection. And once we're able to do that, if we are able to put all TB cases in one room and treat them, that will be the end of tuberculosis. So it is not an impossible goal that has been set. It is not impossible. It is possible. Okay. But we really have to do a lot of work.
On a final note, what advice do you have for members of the public and people living with tuberculosis?
Well, for members of the public, the first thing is get involved. You are only free of tuberculosis if no other person has tuberculosis. It's transmitted through the air. If a person has TB and coughs or shouts or sneezes, the germs come out of him. Whoever is near him that will breathe in the air gets infected. So the only way to be safe from tuberculosis is to ensure that every other person is safe. And so, as I say, everybody should be involved. It is everybody's concern. And all TB patients are living with people. They are living in our societies. They are the people that will go into the bus together. Anybody that we know, ourselves or anybody that we know that has cough that has gone on for 2 weeks or more, let's help that person, let's advise the person, let's inform the person. Get to a place where you can get diagnosed for tuberculosis, and if it is tuberculosis, get treated for it. So it's something that must concern all of us, because all of us are at risk. For the TB patient, well, we have what is called a patient's charter. They have their rights and they have their responsibilities. Rights to free diagnosis, free treatment, confidential management, but also the responsibility of not transmitting their disease to others. TB is transmitted through the air. So what we need to fight that is cough hygiene. For the TB patient, for the general public, we must practice cough hygiene. Simply put, cover your cough. If you must cough, if you have a cough or if you are going to sneeze, ensure you cover your mouth and nose. If that air doesn't get, into the open, then you are not transmitting the disease. So that will be my ultimate: cover your cough. That's a message that all of us, whether we think we have TB or we don't have a TB, we must cover our cough. That way we will stop TB transmission.
Thank you so much, Doctor, for your analysis.
It's been nice talking with you.
That was Dr. Hussein Abdulrazak, the Tuberculosis Control Officer with the Lagos State Ministry of Health, on ending tuberculosis in the country. Sound Health continues with Trending. Please don't go away. On Innovation this week, medical experts reveal liquid biopsies find circulating tumor DNA. That's in a moment. Please don't go away.
Liquid biopsies to find circulating tumor DNA.
A simple routine blood test can diagnose a serious disease. Blood work tells you not only the source of the problem, but its progress. A defined treatment plan is then matched to the diagnosis. Can healthcare go further? In 2009, there was great excitement over circulating tumor cells that could be found within the blood and determine progression of the disease. Could there be a test that goes deeper than the cell? The next step has arrived. The liquid biopsy seeks signs of actual DNA. Cell-free circulating tumor DNA, ctDNA, is shed from a tumor into the bloodstream. ctDNA is greater than 100 times more abundant in the blood than tumor cells. The frontier of the liquid biopsy is wide open. Experts believe it's only a matter of time before catching and treating cancer is as routine as your annual checkup.
Hope you enjoyed this week's edition of Sound Health. For comments and inquiries, please send SMS on 0818-815-3965 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.